Don't disturb. Haya, so haya, dada, yes, niangalie sana sana wapi? Hapa. So naweza
hapa ulete hapa. Kwa kwanza hapo. Ukitoa imepotea. Yala hii tarehe hapo.
Mike venye ulinisetia ile ya Afrika liko sawa hapo?
Madam bibi sio toto lele bibi kwa bara pia. Huyo aikirie mweli wake.
35.
the melanin queen. Sisi ni wale tuliosaidiwa na Mungu, sisi ndo wale tuliobarikiwa na Baba, sisi ni wale tuliosaidiwa na Mungu, sisi ndo wale tuliobarikiwa na Baba. Sina hela, sina pesa, sina doo, sina nyumba, sina gari, sina hoo. Kila kukikucha minayowaza kesho, tapiga moyo konde nitafika hoo. Wanaokudharau leo watakusalimia kesho, wanaokusema sema watakusifia kesho. Unaokula nao na kucheka nao, kesho kidondoka utakuwa nao. Piga moyo konde, wakati wa Mungu, wakati sahihi. Piga moyo konde, wakati wa Baba, wakati sahihi. Sisi ni wale tuliosaidiwa na Mungu, sisi ndo wale tuliobarikiwa na Baba, sisi ni wale tuliosaidiwa na Mungu, sisi ndo wale tuliobarikiwa na Baba. Jana niliumwa nikadhani nitakufa, leo niko fiti, ukinicheki nadumbika. Nilipojishwa kazi walidhani nitasota, leo niko juu, ile kibosi nadumbika. Kama unaamini umesaidiwa na Mungu, piga kelele, kelele moja, kelele mbili. Kama unaamini umesaidiwa na Mungu, piga kelele, kelele moja, kelele mbili. Sisi ni wale tuliosaidiwa na Mungu, sisi ndo wale tuliobarikiwa na Baba, sisi ni wale tuliosaidiwa na Mungu.
Our Facebook viewers, our YouTube viewers, ladies and gentlemen, Welcome to our Health Fellowship Hour. We are live. We are here in Naivasha in our office, the marketplace building, located along the highway opposite Kenya Women, next to Jambi's Hotel. So kindly, I request that we may all tune in, subscribe in our YouTube, comment, and also like. Now, my name is Geoffrey Kirato. I am a Greenwood African Region trainer, and I will be your trainer this evening. My name, as you can see on my screen, I've achieved several training, like being the best in Africa as well in Kenya. And I believe that you are going to learn a lot from our training today. I will train you on Greenwood, one of the best and powerful Greenwood product that is known as A-Power. Now, allow me now to start my product training about the A-Power. And when we talk about A-Power, even as the name suggests, it is a powerful product from Greenwood. A-Power is generally a product for HIV and AIDS, but that doesn't mean that it can't be used by other people. Basically, what it does, it is our main major immune booster product. So when you use it, you will be able to improve all the conditions or the issues related to the immunity. Now, my training will be divided into two sections. Section number 1, I will deal with how HIV attacks the CD4 cells of our immune system. And when we talk about the CD4 cells, these are basically the white blood cells. Then the second part, I will be talking about how A-Power deals with this virus, the HIV and AIDS virus. Let's start by understanding the origin of this HIV. HIV is an abbreviation for human immunodeficiency virus, and a bit of its history. It is believed that HIV came from a species of a monkey known as chimpanzee as a simian immunodeficiency virus. So when this virus attacked this monkey chimpanzee, it was known as it is known as a SIV, simian immunodeficiency virus. Later, it spread across Africa and later into other parts of the world. How is it passed? How was it passed from this chimpanzee to human being? It was passed to human when they hunted these chimpanzees for meat and came into contact with their infected blood. That's how it entered into human being. Now, let us see how this virus, the actual thing it does for it to destroy our immunity. Now, we want to see how this virus attacks the CD4 cells and also how it destroy and spread into our body. Now, I want you to look at the photos to see the photos. You can see, I hope you can see the HIV virus, how ugly it is and how it looks. And then the second part of it is the CD4 cells, generally known as the white blood cells. And we all know that white blood cells are the cells responsible for our immunity. Then there in between, we have something that look like a thread like known as the CCR5 or CXCR4 core receptor. Let's now discuss and see how this HIV virus attacks or enters into the CD4 cells. Number one, what it does, HIV gets inside the CD4 cells, and once it enters, it makes copies of itself and then spread. Then it enters through this CCR5. These are just proteins that are found in white blood cells as a receptor for chemokines, and their main function, they act as a signals. So this protein, they usually receive the signals. Then these CD4 cells, sometimes they are also known as T cells, meaning and their main function, or what they does in our body, is that they clear or kills the viral infection. And T means dimers or dependent development. Now you can see if these cells, they are the one, if they are the one that are responsible for destroying the viral infection, now you can imagine when now this virus of HIV enters into it, and it destroys the CD4 cells. So the whole body, the whole body immunity will be at a mess. And now we continue. How does HIV spread from one person to another? So we have 5 major major things or major issues that can spread this deadly virus. Number one, we call it unprotected sex with an infected person. Number two, sharing injection during injection drug equipment like needles with an infected person. That one will also transmit. Number three, receiving blood transfusion can also, especially a blood that is already infected with HIV, can also transmit this virus. To babies during pregnancy, birth, or breastfeeding, and also to non-sterile or instruments like needles, sticks, etc. So those are the major things that can transmit this HIV virus. Then how HIV and AIDS is not transmitted. Actually, these we used to call them myth and misconception. So these are the things that cannot cause or cannot spread HIV virus. Number one, HIV and AIDS cannot be transmitted through touching, like shaking. It cannot be transmitted through food, so you can eat together with a person who is infected, and you won't be infected with this virus. With a kiss, kiss cannot also transmit this virus. Insect bite, like mosquito. So when a HIV positive person is bite by this mosquito, and then it also bite a person who is not infected, he or she cannot be infected with this virus. In the pool, swimming pool, so you can swim together with an infected person, and you will be very safe. Now allow me now to discuss the 3 major stages of HIV and AIDS. The HIV and AIDS undergoes 3 major stages. Stage number 1, we call it acute HIV infection. In this stage, people have a large amount of HIV in their blood, and this stage is so much contagious. Number 2, many people have flu-like symptoms. You feel a lot of flus that is happening frequently. And if you have flu-like symptoms, and you think that you have HIV, is good you get assurance by being tested, because the only proven way that we can agree now, that we can conclude that you are HIV positive, is through testing. Then stage number 2, we call it chronic HIV infection. That is the stage number 2, also known as asymptomatic infection or clinical latency. During this stage, HIV is still active and continues to reproduce in the body. People may not have any symptoms or get sick during this phase, but can transmit HIV. Number 3, people who take HIV treatment is prescribed may never move into stage 3, which is AIDS. So it is advisable that immediately you are tested with HIV and AIDS, it's good you start using the medication like ARV. Without HIV treatment, this stage may last a decade or longer, or may progress faster. So that is stage number 2. Let's now move to stage number 3. Stage number 3 is known as acquired immunodeficiency syndrome. This is actually the 8th stage. So HIV starts as a virus, then it moves to a syndrome known as AIDS, acquired immunodeficiency syndrome. This is the most severe stage, and people with AIDS can have a high viral load and may easily transmit HIV to others. Number 2, people with AIDS have badly damaged immune system. They can get an increasing number of opportunistic infections or other serious illness like different types of cancer. And also, without HIV treatment, people with AIDS typically survive about 3 years. So if you are at stage 3 and you are not using the medication for the AIDS, then the lifespan changes to only 3 years. But that one should not make you worry, because there are several methods that you can use to improve your health. Now, let us look at the treatment. HIV and AIDS treatment. People people living with HIV work with a healthcare provider to choose a HIV regimen. So there are several medications that you can use, but it's good also to seek advice from your healthcare person so that he or she can advise you on the best package to use. Those are mostly what we call ARV or ART, mostly known as antiretroviral drugs. Apart from the antiretroviral drugs, there are also other ways or more ways that you can manage HIV and AIDS. Number 1, you can keep your immune system strong, because remember, this virus attacks our immune system, the CD4 cells, the white blood cells. So if you can keep your immune system strong, then you'll be at a good health. And how do you keep your immune system strong? 1, by eating right. When we talk about eating right, is basically taking balanced diet. Then quitting smoking. For those who smoke, is good you quit smoking, because smoking lowers our immunity. And also learning how to avoid infections, because as earlier mentioned, that we have several opportunistic infections that usually affect the HIV and AIDS patient. So, and you remember that your immunity is weak, so if you allow those infections to attack you, then it will be very hard to eliminate them. So it's good to avoid those infections. Number 2, you can monitor your CD4 cells. Those are white blood cells count, to check the effects of the virus on your immune system. Then number 3, reduce stress. Stress lowers our immunity, so it's good to reduce stress, though I know it is hard, but it is good you try your best to keep yourself from stress so that you can better manage HIV and HIV virus illness. Now let us see some of those CD4 cells. A person with HIV is considered to have progressed to AIDS when: number 1, when the number of their CD4 cells falls below 200 cells per cubic millimeter of blood. A healthy person is supposed to have between 500 and 1600 cells per cubic millimeter of the blood. But now, when you realize that the CD4 cells are below 200, then that means that you have moved to the severe stage of HIV and of AIDS, which is AIDS. Then they develop one or more opportunistic infections regardless of their CD4 count. So when you see somebody now being attacked with those opportunistic infection, that means that now that person has progressed to AIDS. Without HIV medicine, people with AIDS typically survive about 3 years. Once someone has a dangerous opportunistic illness, life expectancy without treatment falls to about 1 year. So again, I repeat that it is advisable to make sure that you are using ARV or antiretroviral drugs so that your life expectancy can increase. Let's see now those opportunistic infections. And when we talk about opportunistic infection, they're also known as OIS, and they are in 5 categories. Category number 1, we call them yeast infection. So we have those opportunistic infections that are in a category of yeast. In this category, we have 3 of them. Number 1, we have candidiasis. This mostly affects the vaginal, the female vaginal. Mostly we call them vaginal yeast. Then we have coccidioidomycosis, and this one is also known as valley fever, mostly commonly known as valley fever. This one affects the respiratory system, so we also call them the respiratory yeast. Then the third one, we call it cryptococcosis. This one affects the pulmonary, also known as pulmonary infection. Then the second category, we call it parasitic infection. These are in 2 categories. Number 1, we call it crypto. The crypto affect the small intestine, so we call them the intestinal infections. Then the second one is also known as a cytosporiosis. It also affects our intestinal organs, known as intestinal diseases. And this one is characterized by watery diarrhea and also vomiting. Then the third one, we call it herpes. Herpes are generally also or known as, more commonly known as HSV. This is a viral infection, and it is characterized by sores or blisters in the mouth or the genitals. Remember that this viral infection herpes has no cure because it is a viral infection. So it's good to avoid it because once it attacks you, it will be very difficult to treat it. Then the fourth category is known as bacterial infection. This one is commonly or known, and it mostly affect people with the HIV virus. And the common disease that is from bacterial infection is known as TB or tuberculosis. When this virus entered into Kenya, people with TB were considered at a very high rate of having this virus. Actually, doctors could ask you to go and get tested. Immediately you are diagnosed with the TB to confirm whether that is part of the HIV and AIDS virus. Then the fifth category is known as cancer. The cancer that mostly affects the people with this HIV virus is known as Kaposi sarcoma. This one is generally, or in a layman language, the cervical cancer that is well known. So people with HIV are mostly attacked by this cancer known as cervical cancer. So those are the major opportunistic infections that attack HIV virus patients. Let's now move to my second part, whereby now we are going to study in details and learn how this wonderful and powerful product, A-Power, how it deals with this virus. Now, let us look at A-Power itself. A-Power is mostly for a product for HIV and AIDS, but also for other conditions that are related with the immunity. And it has 5 main ingredients. Ingredient number 1 is Ganoderma. Ingredient number 2 is Ladix astrogari extract. Ingredient number 3 is honeysuckle extract. And ingredient number 4 is lead ginseng. And ingredient number 5 is sea buckthorn extract. We are going to look at each of these ingredients and how they improve people with HIV and AIDS disease. Now, let us start with the first ingredient, which is Ganoderma. Actually, Ganoderma is the key ingredient for A power, and it is also commonly known as, according to the Chinese traditional medicine, it is commonly known as mushroom of immortality. That means that never die. So when you use these products, it can bring back life. It can bring somebody who was at a severe stage of any disease back to a healthy life. Ganoderma is a mushroom. You can see from my pictures there. It's generally a mushroom. It's a type of a mushroom that is very, very beneficial to our health. What does it do? It does 3 major roles on improving our immunity. And actually, Ganoderma is known as a product for cancer. What does it do on cancer? Number 1, it prevents the onset of cancer. Number 2, it discourages cancer cells spread. And number 3, it lowers the risk of relapse. Then let's see now how it is related with HIV virus. Ganoderma increases the CD4 cells number. And remember from my introduction, this HIV virus usually attacks the white blood cells, which are the CD4 cells. Now, Ganoderma comes as a solution by increasing the number of white blood cells. According to the Chinese and Tanzanian professor and scientist, they had carried out a pilot of clinical trial on the therapeutic effect of Ganoderma preparation on AIDS patients in Africa. What was the result? The preliminary result showed that when Ganoderma was used in conjunction with antiretroviral medicine, AIDS patients weight gain. Number 2, CD4 cells number increased. Number 3, red blood cells level also increased, and other indicators were significantly increased. The effect is twice that of a patient who are only given the retrovirus group. Now you can see. So if someone is diagnosed with HIV and AIDS, then he or she is recommended with this A power, which has Ganoderma. So the improvement effect is twice compared to that person who only take the retrovirus medicine. Now, let us see how Ganoderma has anti-cancer effects. 4 types of immunoregulatory proteins have been identified from Ganoderma, all with the anti-cancer effect. The polysaccharide and other active components of Ganoderma also play a key role in its use for treatment and control of lung cancer, liver cancer, melanoma, leukemia, and colorectal cancer. Their anti-cancer effects were exerted through enhancing the functions of the dendritic cells, the T lymphocyte cells, the B lymphocyte cells, and also the natural killer cells. commonly known as NK cells and other macrophages. So you can see generally how this Ganoderma ingredient in A power, how it increases our immune system by increasing all the cells that are responsible for our immunity. Let's now move on to our next ingredient. And this ingredient, we call it Ladix astrogalus. Ladix astrogalus. So the main function of Ladix astrogalus, it is that it inhibits the virus replication of HIV. Now, this ingredient has antibacterial and anti-inflammatory properties, and this product is responsible for the replication, so it inhibits the virus replication. What does it mean by replication? When you talk about replication, is just duplication or reproducing or multiplication. And remember, our main agenda is to see any product or any ingredient that can inhibit the virus spread, this HIV virus spread. And now this Ladix astrogalus is doing it so well. This product, according to the American scientists, they have found through a long-term research that the traditional Chinese medicine Ladix astrogalus contains a substance TA2, TAT2. So this TAT2 is generally tryptophan permease gene that inhibit the virus. It is the actual substance that inhibits the virus replication. Now, this TAT2 can effectively inhibit the virus replication of HIV and has a special effect on the treatment of AIDS. What does it do? This Ladix astrogalus is also very effective in treating immune diseases associated with chronic infections and also viral infection. So these are Ladix astrogalus ingredients in A power is so much effective and very, very effective in fighting HIV virus. Now let us look at the third ingredient. This one we call it honeysuckle extract. Basically, this honeysuckle extract has anti-cancer and antiviral effects. Remember, we are looking at all the ingredients that can inhibit this virus of HIV spread. And now from number one, or from introduction, you can see that this honeysuckle is qualified for fighting HIV virus. So what is this product or this ingredient? According to the traditional Chinese medicine, it is also known as penicillin. And this product is a good remedy for clearing heat and detoxifying. It also inhibits virus replication. Honeysuckle water decoction has shown a moderate inhibitory effect on the HIV virus, which to some extent can inhibit the virus replication and delay the occurrence of virus-induced cytopathic changes. Honeysuckle extract has an immune-enhancing effect and can promote the phagocytosis of the white blood cells. So this product is so much effective and very relevant in A power. It is among the products that makes the A power to be powerful. Let's now check on the other ingredient, which is known as ginseng. More specifically, the red ginseng. Ginseng is extracted from a steamed ginseng root. So this is a type of ginseng that is extracted from the root of the ginseng plant, as you can see. And ginseng, according to traditional Chinese medicine, ginseng is regarded as the king of herbs, just like in the wilderness, whereby a lion is considered as the king of jungle. Ginseng is the king of herbs. So it is the best herb in the world, is the most effective herbs in our body. What does ginseng does? Number one, when you take ginseng makes aging people young. It lets dying people live. It is a words of fatigue, or it is anti-fatigue. It adds decade to one's life, and it is also a powerful tonic herb. Ginseng has three things that it does to prevent or fight cancer or tumor. Number one, ginseng is anti-cancer. Number two, it inhibits tumor growth. And number three, it improves cells immunity. Now, research has shown that red ginseng possesses a powerful anti-cancer property because of its ability to inhibit tumor growth. Reports conclude that the improvement in cell immunity involving the T cells and NK cells, the natural killer cells, along with other mechanisms such as oxidative stress and apoptosis, gives these herbs its anti-cancer property. So if you get somebody suffering from cancer, the first and the foremost product you are supposed to recommend is the ginseng. Let us see now how lead ginseng curbs the replication of HIV. Remember, our topic is about how to fight HIV and AIDS virus and how to reduce or slow it is spread. Ginseng, ginseng number one, what it does, it destroys the NEF gene. It is reported that NEF gene in AIDS patients has the function of promoting the rapid replication of AIDS virus, while red ginseng can destroy the NEF gene, thus curbing the replication of HIV. So this virus, number one, it attacks the NEF gene in AIDS patients. And now uh, it is supposed that the NEF gene in AIDS patient has the function of promoting the rapid replication. So the NEF gene in AIDS, it is the one responsible for the replication of HIV virus. Now, when these ginsengs come along, it destroys this NEF gene, therefore reducing the replication. This result was published in the fourth issue of Clinical and Diagnostic Laboratory Immunology in the United States of America. Let us see at the, about the other ingredients, and that is sea buckthorn. Sea buckthorn is in a local language where it originates from. It is also known as a holy fruit, and it contains over 190 kinds of bioactive, which are much more abundant than in any other fruit or vegetable. So this product, sea buckthorn, actually it is a fruit, as you can see, the bird enjoying this fruit of sea buckthorn. It is the most effective vegetable or fruit on earth because of this property of 190 kinds of bioactive substances. Sea buckthorn extracts inhibit the growth of pre-existing tumor by enhancing the immune system. It is also antioxidant, or it has antioxidant property. It arrests the cell's proliferation in a certain steps of cell cycle, and the anti-mutagenic effect against the cancer-causing agent. So one of the main function of sea buckthorn, it is that it inhibits the growth of tumor. And you know that cancer starts as a tumor before it matures to cancer. So this fruit is able to destroy this tumor before it turns to cancerous cells. Now, let us see on the nutritional support for people with HIV and AIDS. Remember that we said apart from the antiretroviral viral drugs that those HIV patients can take, they're also supposed to boost their immunity. Now here in Greenwood, we have a very nice package, a good package for HIV and AIDS. When you use this, you really improve your health. The first one and the best product that can improve the nutrients or that is of high nutrient value is the A power that we have already discussed about. The next one is spirulina. So number one, a person with HIV and AIDS, you can recommend A power being the first one. Then the second one, you can recommend spirulina. Why? Because spirulina is nutritionally condensed. So it is nutrients condensed. It has almost all the nutrients that the body requires. Then we have the blueberry super nutrition, even as the name suggests, super. So this blueberry product has super nutrients that the body requires. Then we have the other product as the protein powder. So this is the Greenwood protein powder. This protein powder has all the essential amino acids that our body requires, which is very healthy. This is the spirulina that I'm talking about. And then this is the A power. You can see now these three are actually four. These four are the main products that you are supposed to recommend to people with HIV and AIDS. So they are the best one. So you can even see on the photos of the four. So the first products you recommend are the four, and they will really improve the health of people with AIDS. Now, there is an NB, not better. Garlic, by the way, you can also recommend garlic to people with AIDS, but there is a caution here. Although garlic may help strengthen the immune system, garlic supplement may interact with some anti-HIV medicine and reduce their ability to work. So occasionally eating garlic in food is safe. We don't recommend garlic capsules for those with HIV and AIDS. And then greenwood products are friendly when used into conjunction with orthodox anti-HIV medicine. We hope that one day HIV will become a disease that could be completed cured. I have one testimony about A power. During the corona era, so many people immunity were affected, and I recommended this A power to one of the patients, and the patient really improved compared to all other patients. And this patient was already admitted, and after using this A power, he was even this power A power product is good for any immuno issues. Anyone with immuno or with issues with his or her immunity, you can recommend A power. Thank you very much. I recommend that you can also use A power even if you don't have any condition you are dealing with it, just for improving your immunity. Thank you. Once again, we are located in Naivasha town in a building known as the Marketplace Building, that is opposite Kenya Women Bank, next to Jabis Hotel. Welcome to our health fellowship every day from Monday to Friday, 5:30 to 6:30. We are live in Facebook and also in YouTube. Remember to subscribe,
The melanin queen.
like, and also share. Thank you.
Sisi ni wale tuliosaidiwa na Mungu, sisi ndo wale tuliobarikiwa na Baba. Sisi ni wale tuliosaidiwa na Mungu, sisi ndo wale tuliobarikiwa na Baba. Sina hela, sina pesa, sina doo, sina nyumba, sina gari, sina hoo. Kila kukikucha minawaza kesho, napiga moyo konde nitafika hoo. Wanaokudharau leo watakusalimia kesho, wanaokusema sema watakusifia kesho. Unaokula nao na kucheka nao, kesho kidondoka utakuwa nao. Piga moyo konde, wakati wa Mungu, wakati sahihi. Piga moyo konde, wakati wa Baba, wakati sahihi. Sisi ni wale tuliosaidiwa na Mungu, sisi ndo wale tuliobarikiwa na Baba. Sisi ni wale tuliosaidiwa na Mungu, sisi ndo wale tuliobarikiwa na Baba. Jana niliumwa nikadhani nitakufa, leo niko fiti, ukinicheki nadumbika. Nilipotishwa kazi walidhani nitasota, leo niko juu, ile kibosi nadumbika. Kama unaamini umesaidiwa na Mungu, piga kelele, kelele moja, kelele mbili. Kama unaamini umesaidiwa na Mungu, piga kelele, kelele moja, kelele mbili. Sisi ni wale tuliosaidiwa na Mungu, sisi ndo wale tuliobarikiwa na Baba.